move on to the second segment of our event. I would like to invite Ms. Deepti Varghese, who is the current president of Georgia Indian Nurses Association, or GINA. Deepti currently serves as a cardiology and electrophysiology nurse practitioner at Northside Hospital in Gwinnett County, Georgia. She received her master's degree in nursing and family nurse practitioner certification from Mercer University and a postmaster's certification from Emory University. She has taken on leadership roles, including RN supervisor, lead cardiology nurse practitioner, and lead cardio electrophysiology nurse practitioner. She has assisted and developed cardiac electrophysiology programs at HCA Eastside Medical Center, Snellville, Georgia, and Northside Hospital, Georgia, at multiple campuses. Deepti was also featured in EP Digest, the October 2018 edition. Deepti has received several awards, including Department Honors in Nursing, Mercy College induction into the Sigma Theta Tau International Honor Society of Nursing, Nurses Choice Clinical Excellence Award, and Witnessing Outstanding Work Award at Northside Hospital, Gwinnett. With the support of GINA, Deepti has led the medical camp at St. Mary's Orthodox Church, Roswell, Georgia. Deepti, over to you.
Hi, can you see the screen?
Yes.
Thank you, Rochelle. Good evening, everyone. On behalf of the Georgia Indian Nurses Association, I would like to thank Dominic and the entire AMMA team for this opportunity to collaborate and celebrate International Women's Day. Georgia Indian Nurses Association, also known as GINA, is a 501c3 not-for-profit organization. GINA is a local chapter in the state of Georgia of the National Association of Indian Nurses of America. We are an organization of all professional nurses and nursing students of Indian origin, heritage, that creates a community of excellence in nursing practice and healthcare through professional development, networking, and collaboration. Please follow us on Facebook and Instagram for more information and updates. I would like to introduce two of our governing board members who will also be moderating the education session along with me. Lily Anika, GINA's education chair. Lily serves as an acute respiratory care unit nurse director at Emory University Hospital in Atlanta, Georgia. Also, Dr. Minnie Jacob, who serves as quality management specialist for interventional cardiology with the Emory Healthcare System in Atlanta, Georgia. We are very excited to present our keynote speakers for this evening. Not only do these women have very successful careers in healthcare, they also hold offices in professional organizations and serve the community, all while balancing a family. They are here to give us inspiration, advice, and shed light on the current hot topic, COVID-19. I would like to introduce our first keynote speaker, Dr. Anupama Gotimukala. Dr. Gotimukala is a board-certified pediatric anesthesiologist in San Antonio, Texas, and has been in practice for over 13 years. After graduating with distinction from Kakatiya Medical College, NTR University of Health Sciences, she completed her residency from University of Miami, University of Illinois, fellowship in pediatric anesthesiology from the University of Michigan. Dr. Gotimukala is the president-elect of American Association of Physicians of Indian Origin, AAPI, and will be the president of AAPI in the year 2021-22. She will be the fourth woman elected to be president of AAPI in its nearly 4 decades long history. Dr. Gotimukala's goal is to make AAPI a premium leader in healthcare, promote charitable activities globally, and help indigent communities, promote health awareness, specifically on heart disease, diabetes, obesity, and cancer, develop a support system to members who face racial discrimination in the US, and support legislative efforts to make healthcare better and affordable to everyone in the States. Please join me in welcoming Dr. Anupama Gotimukala.
Thank you. Thank you so much, Deepti. That was an amazing introduction. And I want to thank the Association AMMA and GINA for inviting me to be with you all tonight. And so today is my mom's birthday. That's a perfect day for spending with all of you, with all the moms in this universe. And just want to say a few words on the women leadership, why women are needed in leadership. So women play key role in the family and for sustainable development and quality of life. So the woman performs so many roles, as you all know, as wife, mother, teacher, organizing things at home, administrator, director, disciplining the family, economist. They look at the bills, they pay the bills, and also health officer. They are the better doctors at home than any one of us who are much more qualified, but still mom is mom, right? And many other roles. So thus women holistically, they play a very key role in the socio-economic development of the society. So in this emerging 21st century, so we need more women leaders. We are hardly like less than 30% in the top leadership roles, and women of color are hardly 5%. So we need to see more and more of women in leadership. So women is the force, and women is the source of power. Women is symbol of progress, and women is the pioneer of the nation. So I want to wish every woman in the universe globally a happy International Women's Day. We celebrated on March 8th, but we want to just reinforce our efforts as women. And I want to thank all of you for being here today. And my special thanks to all the Kerala nurses. They are the excellent globally, all over the world. Kerala nurses are the best. And nursing quality is very high in the state of Kerala. So on behalf of AAPI, we are working with the nurses in India to get the best education for nurses. There's a lot of things going on through AAPI Global Education. So if any one of you are interested to extend your services, I think that's a perfect platform. We can provide the services through you, educating the nurses in India as well. So today's topic, a brief topic, I want to talk about the on COVID. So one of you can play my PowerPoint. If Dominic, you have my PowerPoint, you can play it.
Yeah, we're playing it. One second.
There you go. If you can go to the slideshow. All right, so I want to briefly talk about COVID vaccines, where we are. And next slide. So as of yesterday, I don't have today's numbers, but as of yesterday, if you see worldwide and in United States, how many cases of COVID have been, 119 millions have been infected, and many more actually undocumented. And in US, 29 millions have been infected with COVID, and still we are 60,000 every daily cases. So we are coming down, but still not there yet. And deaths also, look at the world, deaths, 2.6 millions have died, and in US itself, 530,000 people have died with COVID. Next. And as we see, we have 3 types of vaccines right now in United States, which are authorized by the CDC and FDA: Pfizer, Moderna, and Johnson & Johnson. So Johnson & Johnson is a new one, which is yet to be given. It is authorized to be given. And the other 2 vaccines, which are shown on the slides, AstraZeneca and Novavax, are still in the phase 3 trials. We don't know whether they will come out or not, but still they are in the trials. Next. The vaccine distribution. So they started giving the vaccines on December 14th. So I got mine on December 18th. So far, so they have distributed more than 100 million vaccines, and daily there are 2 million vaccines are being given in United States. And so far, so till yesterday, we have covered 20% of US population with vaccine distribution and administered. Next. So how do vaccines work? I know most of you know about it, but just want to go over. Pfizer and Moderna are the messenger RNA vaccines, and AstraZeneca and Johnson & Johnson are the modified cold virus vaccines. Next. So how do COVID vaccines work? So we have mRNA vaccines right now. So first of all, we need to know some facts about the vaccines. A lot of people are scared to take the vaccine. So COVID vaccine does not give COVID to anyone. This is just an mRNA, does not have any virus inside, and they do not affect or interact with our DNA in any way, because they don't enter into the cell, into the nucleus of the cell, the mRNA vaccine. And the cell breaks down and gets rid of the mRNA soon after it is finished using the instructions how the antibodies form in the body. So if you look at the picture, it shows briefly how the vaccine goes once you inject into the patient, into any person, and then how it works. Next slide. So efficacy of the vaccines, if you see it, Pfizer is 95% effective and Moderna is 94.5% effective. Johnson & Johnson is a new one, but worldwide it has been effective 66%. And in US, in the phase 3 trials, it says 72% effective in the United States. But 86% of the time, it will prevent the severe disease once you are infected because of the COVID. Next. And the variants, we are all worried about the variants right now. So these vaccines are proven to protect against the British variant. Pfizer is more protective against the British variant 117, and little bit less, but they think it is effective for both. Moderna also has shown to be protective against these 2 variants, South Africa variant and the British variant. AstraZeneca, we don't have much information, but they say it is effective 74% against the British variant. Johnson & Johnson, also same thing. The next dosing, as you all know, Pfizer is 2 doses 3 weeks apart. Moderna is 2 doses 4 weeks apart. AstraZeneca is 2 doses a month apart. But the best part is the J&J vaccine, which is only 1 dose. Next. The side effects we all have gone through. I think every one of you have taken the vaccine, but if not, the common side effects pretty much with every vaccine is the same: fatigue, headache, chills, fever, muscle pains, and they just last for 2 or 3 days maximum. So Tylenol is perfect if you have, like, you can't tolerate the fever or anything, chills and all. So Tylenol 1 or 2 doses is fine to take as per the experts. And next slide. But the significant side effects, like what are the significant side effects? Anaphylaxis reactions. There were only 50 cases in people who have received a vaccine from Pfizer, and 4 cases of Bell's palsy, which they say it is like normal for any other population. Moderna also, they have a few cases of anaphylaxis, 21 cases. The interesting part is, it's more in women. That's what it caught my eyes. Why? We don't know why it's more common in women, the anaphylactic reactions. AstraZeneca also, there are a few cases of transverse myelitis, but there's more incidence of blood clots with AstraZeneca. And a few European countries have banned, 4 of the countries, Norway, Iceland, and 2 other countries, they banned AstraZeneca vaccine. And Johnson & Johnson is still not much. They haven't seen any anaphylaxis reactions or anything. So that looks like the safest of all the vaccines which are existing right now. Next slide. Okay, pregnant women and nursing moms, is it safe? We have seen practically pregnant women getting the vaccine, and also nursing moms have got the vaccine. In my practice, I'm seeing it, and they are safe, and they are CDC, even though they have not studied in the phase 3 trials, but they say it is safe, and the risk versus benefit. So benefit is more than the risk. Only one baby, they have seen antibodies after the vaccine. Next. And 20,000 people, pregnant women, have taken vaccine in United States, and none of them had any kind of side effects, but they are watched very closely. They are on intense monitoring because they took the vaccine. They want to watch more closely. So what are the contraindications? Sorry, the slide is a little wrong. What are the contraindications of all these vaccines? The only thing is allergic reactions. If you have allergic reaction to polyethylene glycol, then it's better not to take, or you take it but observe very closely for reaction. So that's why first 15 minutes we have to stay there and watch for these allergic reactions. Next. So what were the recent updates of the CDC? I'm sure every one of you are following what the CDC is saying on a daily basis. So this was on March 8th. CDC has released some of the guidelines. So now whoever is vaccinated, you can gather indoors, who all have vaccinated. You don't have to wear masks. You don't have to do the 6 feet apart thing. Also, if you have if you are in an indoor gathering with people, the less risk for severe disease, so you can have that release of these restrictions. But when you go outdoors, you still have to follow these guidelines, restrictions, wear a mask, social distancing, hand sanitizer, etc. So still we are restricted in terms of gathering, how many people should gather. Each state has their own numbers. Some states have 50, some states have 250. My state, Texas, has almost 50% capacity. We can do an event. So every state is different. And also recently 15 plus states have released the mandate to wear the mask, but hospitals are still following it. We have to wear a mask when you enter into the buildings. Next. So those are my references for this talk. Next. And thank you so much for giving me this opportunity. Everyone in this call should insist on getting the vaccine, and also recommend everybody to get the vaccine. And thank you all, and stay safe. Thank you.